Hi guys, I'm back with my fourth video in my series entitled Anxiety, OCD, Paranoia, and the Drugs Used for Them. I'm going to jump a little off of the subject here because a lot has happened since my last video. I know in the last video I was discussing going to my primary care physician and to my psychiatrist, and both visits went well. Although there were other things that I needed to have checked out as well that have little to do with the issues that are at hand right now, what I speak of on my video. They kind of go together, which I'll get to in a minute, but first I just want to explain what's been going on. I was needing to get a CT brain scan and a stress test because I've been experiencing shortness of breath, and the doctor just thought that it would be good for me to get certain tests done. The CT scan, the brain scan, it went fairly well. It was actually really good, and so that was a bit of good news on the upside. The downside, I had a stress test done. I'm not allowed to get on the treadmill because, well, number one, my knee is so full of arthritis that I'm having an awful time walking right now, and I was so out of breath at the time that they just didn't think the treadmill would be the way to go, so they went with a chemical stress test. Now, I've had the dobutamine chemical stress test done before. I'll tell you what, it's awful, especially if you have anxiety, because it puts you in a state of anxiety quick, and I mean like with the quickness. All of a sudden you're calm, and then all of a sudden your heart's beating a mile a minute, and you feel like you just have run the triathlon, and it's scary as hell. And thank God I did not have to get that one done. I did still have a chemical stress test done. I believe it's called the Celsius test. I could be pronouncing it wrong. It is a less strenuous chemical stress test than the dobutamine one. And even though it was less stressful or less strenuous on my heart, it showed that my heart, the results came back, and it showed that my heart was not performing correctly. And that scared me really bad because, well, for one thing, I mean, if I'd gone through the dobutamine stress test, which, of course, I think was about 5 years ago, it could be a little longer, and that didn't affect my heart, why then would a lesser strenuous test affect my heart? Well, a lot of factors go into that, as far as my age, weight, my stress level, how my condition is. Your body doesn't stay in good condition forever, and if it's not in good condition to begin with, it's probably not going to get any better on its own unless you have some help, and healthy eating and all that, and exercise, and working with your doctors. So, long story short, she right away took me from work. I did go back to work a couple days on May the 14th and 15th. But after that, I was not allowed to go back until I see the cardiologist, because she was very concerned, knowing my job is very highly stressful. It's very strenuous, a lot of heavy lifting, I've mentioned before. And so I was unable to work, which is really a bummer because that means no money. But it's like, what's more important? And of course, you know the answer to that. So, okay, I had a appointment scheduled to see the cardiologist. Unfortunately, the day before or the afternoon before, I was rushed to a ER at a hospital because, well, quite honestly, I thought I was either going to have a heart attack or stop breathing. I could barely breathe. Just walking across the room was something that I almost couldn't do. I would get short of breath just doing that. My ankles had turned into cankles. I mean, I'm not trying to be funny here. I know I'm a big woman, but the fluid on my body was so intense. The only way that I can explain it is if any of you are old enough to remember the Michelin commercials. Maybe you aren't, but there used to be the Michelin tire commercials, and this cartoon dude that was like his body was made of these white tires, and he was just completely bloated, and that's what I was. I mean, I look bloated on video, and I am a heavy woman. I'm not thin, of course. I know you can see that, but this is nothing compared to the way I looked. I mean, my fingers were like twice this size, and I have, pretty big hands, but I mean, I could barely bend them. Um, my feet felt like I was walking on um, sponges, and my chest was hurting, of course, and out of breath. So, anyway, long story short, I had to go in the hospital for a minute. Well, for 3 days. And that wasn't any fun. I mean, you know, um, I was completely out of it most of the time because they were trying to, of course, get rid of the fluid was the most important thing first, which they ended up putting me on yet another diuretic. So now I'm on 3 diuretics and a potassium pill. And of course, they were giving me shots of morphine and Percocet pills for the pain, chest pain, for my knee pain, trying to make me as comfortable as possible because, when you're in the hospital and you don't feel well, of course, they want to try and make you comfortable. And they did an excellent job. I mean, it was great. I did get dismissed from the hospital, but I needed to see a cardiologist, and they recommended that I see a cardiologist as soon as possible and get a cardiac catheterization done. So I went back to my doctor, and we made arrangements for me to go and see the cardiologist, which I just did a few days ago. Um, Actually, when I was in the hospital, they gave me this breathing machine. I don't know if you can see it. What you do is you inhale on it, and they got it set at a certain point, and it's supposed to go up to that point when you inhale. And I was barely making it to that point when I was in the hospital. Now I'm a little bit better. By the third puff, I'm not quite at the point where I should be, but I think that I'm getting a little better. I mean, I don't know. So anyway, I saw the cardiologist, and he did recommend I get a cardiac catheterization done because of a possible blockage in my arteries. He's very concerned because of the heart disease that runs in my family, on both sides of my family. Emphysema, heart disease, cancer, diabetes, mental illness. This all runs in my family, on both sides of my family. And and of course I still smoke. Yeah, I'm still smoking, and he wants me to stop. I mean, I know you all are probably sitting there like, well, what the hell's the matter with you? Well, you know how it is when you're addicted to something. And the nicotine, it ain't, it's a motherfucker. I mean, there's no other way to put it. I mean, But I do have an electric cigarette. I know that my primary doctor wants me to lose the weight for the diabetes. She takes precedence over that. Well, the cardiologist says, screw the food, quit smoking. And I'm like, well, I mean, he wants me to do both, really, and I don't see too many people succeeding losing weight and quitting smoking at the same time. I mean, I just haven't seen that done. Um, that's going to be something that's a long process. But anyway, I am glad that I went to see the cardiologist. And I do have a cardiac catheterization scheduled for about a week from, well, actually, no, it's probably, 1, 2, 3, about 3 or 4 days from now. So I'm, of course, anxious. This is doing absolutely no good for my anxiety, and I mean, it's not. So I just wanted to let you know briefly what has gone on since the last time I made a video. I am going to continue with some more this day. I know I'm on limited time here, so I just wanted to make sure that I got that point out first. And I'll catch you in a few minutes. Okay, thanks. Bye-bye.